She will treat you for free. And she will treat your family for free, even if you pass away. She'll take care of your family for the rest of their lives. And she can do that because she has eliminated those government contracts and, frankly, the insurance contracts. Her patients can use insurance, but what they do is they then file a claim directly. The insurance companies don't like that. But they still use their insurance. But instead of spending her time on being an insurance billing clerk or a government bureaucrat billing clerk, she's treating patients. And she says that doctors around her area, she's outside of Austin, Texas, hence the accent. And she says that doctors send her cases all the time. And the reason they do, she says, it's not because I'm that much better a doctor, it's that I have time. I take time with my patients. So the next time that you hear President Obama or somebody talking about those greedy doctors who only care about money, I want you to remember Dr. Jules. And you can talk about Dr. Jules. And if you actually want to see her in action, she's on the AAPS website. So there's tapes that you can see that yourself or share it. Now also, I mentioned that about the insurance billing clerks. They tell us that administrative simplification, by having this all go through the government, is going to save a lot of money.
Yeah, right.
Here's the stat. It costs doctors 50% more to process a government insurance claim than it does to process a private insurance claim. So, not that it's that great processing the private claims, but it's 50% more for the government claim. They get rigid. Now, let me tell you about the insurance companies, what they do. Here's what's going on with the insurance companies. They want to keep the billing going through the doctors because they don't want to have those individual claims come to them because then they all have to pay them and in a timely manner. What they do to the doctors is doctors have to batch their insurance claims. They send all of their claims to the insurance company in groups for all the patients that they have. So that gets batched in. So then on the very last day of when they're supposed to file that claim, or to pay the claim, the insurance companies will find something wrong with one of the claims, one patient. Well, then the whole batch comes back, is sent back to the doctor. And they have to fix that one thing. Now, doctors have literally thousands of codings that they have to do, which, by the way, the AMA makes about $76 million a year on selling those codes. The government allowed them the copyright on it since the government couldn't hold it. So it's easy to make a mistake, but then they come back. So the insurance companies have this way to increase their float and the way that they keep their money. If you start filing claims to them, you start to cut into their flow. Now, that alone seems a reason for you to start filing the insurance claims yourself. Instead of asking physicians to act as insurance billing clerks, I think you're all smart enough to do that on your own. We've been told that you're too stupid and too feeble, in Medicare especially, that people can't figure out how to file an insurance claim. So, that's some of what doctors are up against. Now, for patients, what does that mean? I've already told you, doctors are going to be leaving. They've had it. I have never seen doctors rally the way I have seen doctors rally in the past 30 days. I wouldn't have even expected this 2 months ago, from what I've seen. I had trouble getting doctors to come out and speak, and now they're calling me and volunteering to speak. If you have special needs, if you have a special needs child, let me mention why I talk about this. Let's talk about comparable effectiveness research. This is a little thing that says that the government sets up a national health board that decides what are cost-effective treatments. And if this bill passes the way that it's set up, that will go into force. So the doctors will be paid based on how well they follow those guidelines. Now, that's based on cost savings for the average patient. Okay, show of hands. Who's an average patient? Oh, stop it, you are not. Wrong answer. You missed the pop quiz. You're not an average patient. No one is an average patient. not a one-size-fits-all. So you tell me, and that's what they have in Canada and Great Britain. It's called the NICE board in UK. My 85-year-old father had bypass surgery and 5 valve replacements at the age of 85. Do you think he would have gotten that in Canada or gotten that in Great Britain?
No.
And he just came back last week. He's now 80. He had it at 84. He's now 87. He just came back last week from 2 weeks up on a federal disaster, a flooding disaster up in North Dakota as a volunteer for FEMA. So those are the kinds of things. If you have a special needs child, there's language in the bill that they will have a special authority set up to consider special needs. And I don't mean that in a good way. If you have a child, if you're interested in alternative treatments or acupuncture, any kind of thing like that that's considered chelation therapy, anything that's considered a little bit alternative, you will have a very hard time getting it. You have a hard time getting it now. It's going to be much, much harder. So this does not look good for patients. If the doctors are going and you're having to fight the government, now let me explain the difference here. People will say, well, we already have rationing. The insurance companies ration. No, not really. The insurance companies say that they won't pay for a certain procedure or treatment. Now that's based on the contract. Now that's not great, but the difference is that when the government says you can't have it, you can't have it. That's rationing. That's the difference.
See how they treat the Indians.
Yes.
The Indian Health Service? I've just been trying to learn about the Indian Health Service a little bit. There are some other things that are problematic in here. There are some provisions that, because of the requirements that you have insurance, there are provisions that they can really kind of rifle through your financial records. Privacy is pretty much out the door. And the key for this comparable effectiveness is the data collection. If they have to have all the numbers from your treatments to crunch all your medical records to come up with those numbers. So then we now move into the national database of your medical records if this goes through. We've had the enabling legislation for that for 10 years, and 15 years, and they've been looking for a way to do that. So now the one thing that I would disagree with one of our previous speakers is that in the bill, there are 2 big elements of the public plan that you've talked about, and then the mandate. I believe that the mandate is the bigger problem than the public plan because, and here's why I think so. If we don't have the public plan and have a mandate, people will be mandated to have insurance. You'll have to be told to buy insurance. You know people are going to yell and scream that they can't afford it then. Eventually, we'll have to come up with some mechanism for them to afford it or to give it to them. So eventually, I believe that is what will lead us to single-payer socialized medicine in this country. If we do have a public plan without a mandate, if people don't want to go to the public plan, they won't go to the public plan if it's a lousy plan. So that's why it's the mandate that I really fear. Now, for example, I always call myself, I'm an insurance hostage. Here in Washington State, I can't buy the insurance. This is a story I keep telling Patty Murray. I keep writing on her website when she sends me an email and asks for, please tell us your stories. Here's my story. I am a healthcare hostage, health insurance hostage. I know that gets their attention, right? They're going to go, oh yeah, we got one. Okay, let's go. Except that what I say is that I can't buy the insurance that I want. I want a high deductible policy. I want a $10,000 deductible policy. I want something for an HSA. And you know what? In King County, it's not here. We have so many mandates in this state that the insurance companies have gone out. They couldn't compete here. So the policy that I really want, I've got group health now. I pay $190 for my policy for something I don't want. And I had an actuary crunch the numbers for me. If I could get the policy I wanted in Washington State, it would cost me $47.
Exactly.
So again, that's government in the way. So the single payer, they're moving us towards a single payer. I've got a